Thanks for attending today's session, or what we might call a town hall meeting, where your CPTN President Patty Pinnell and I are afforded an opportunity to present the concept of an MSO by way of this short video. Afterwards, we'll have a short session of question and answers and further discussion about the MSO. As we've sent to you over the last year or more, the days of fee-for-service and incremental fixes by healthcare policymakers have not worked. We are fully moving forward toward value-based models, including reimbursement, and to collaboratively achieve the best outcomes at the lowest total cost. But until most recently, providers have not had a financial incentive to deliver value. We still seem to be of the mindset of the more I do, the more I'll get paid. However, with value-based alternative reimbursement methodologies, financial incentives are beginning to reward value. But how does one deliver value? Many healthcare experts and health plan pundits believe providers must measure and use outcomes and collaborate with others who add value with you. What is an MSO? An MSO is a group of like-minded practices or clinics that come together under a singular tax ID, also classically defined with also a centralized billing service, and foremost, we believe, the collection of outcomes via a standardized tool. Therefore, an MSO can bring measurable value to member practices in helping to reduce operational costs, but the big game plan of improving or attempting to improve reimbursement and to strengthen market position. For the health plans and ACOs, with a singular tax ID, this helps simplify their processes and reduce their administrative costs. And then we give them predictable outcomes and costs. The two big reasons to organize as an MSO: for the health plans, to reduce their administrative costs by providing economies of scale with a singular tax ID. For the clinics, if enough clinics support the MSO, we then have the strength of size and may assist as to negotiate better rates. This slide, moving from left to right, shows levels of integration of groups of clinics, from loose to more structured integration. The MSO level provides a high level of integration, allows contracting strength, but trust is a key component. Trust and collaboration with the other members of the MSO. Our current form shows complexity as perceived by the health plans, with multiple tax IDs of having to process and pay to all the individual tax IDs. But an MSO with a singular tax ID escalates the possibility for risk sharing, alternate reimbursement methodologies. A singular billing entity consolidates AR management, and billing can be submitted to the health plan, and claims processing and payment can be made to the single tax ID, which can then be distributed to the member practices. A similar inconsistency exists in our current format, with visit utilization being all over the board. And at present, we are not submitting any outcome results, which presents huge difficulties for the health plans in controlling costs. Versus the use of an outcomes tool by the members of the MSO that can be compared to a national average and can show the effectiveness of treatment in achieving functional outcomes and functional change. This would negate the need for the health plans to provide resources or perhaps an intermediary company in controlling utilization. Again, an MSO could provide member practices a better seat at the contracting table to include alternate risk arrangements, centralized billing and integrated EMR technology, credentialing, outcomes training and management. A more mature MSO could provide professional development and assist with local practice management and leadership. An MSO could provide health plans network access of independent clinics for accessibility to care, simplified processes to reduce their costs, particularly related to a singular tax ID, predictable costs and outcomes, ability to effectively manage outcomes versus cost, and value-based risk-sharing models. A highly successful MSO in other markets has been shown to provide a highly collaborative problem-solving arrangement of member clinics. Due to achieving high-level outcomes, they have procured a higher reimbursement. The outcomes predictors, when compared to actual member outcomes, eliminated the need for an internal utilization management program.
I've been the president of the CPTN board for the past year, and Mark and I have been working very hard at looking at different options for restructuring CPTN. After a lot of hard work, we've decided that the MSO is the most viable project. After these next few minutes, I hope to answer any questions you may have as a practice owner, how an MSO would look to your practice and how it would impact you as a practice owner. Probably the most important question right now is what can be gained by forming an MSO. By forming an MSO, 130 individual practices get to form as one at the negotiating table. The power of negotiating with third-party payers, if we had the ability to say yes or no versus our current model where 130 of us get to decide individually, there's just no comparison at the power of that. Also, the advantage of having an MSO is economy of scales. I currently pay for a biller, Sally down the street pays for a biller. We'll all combine that, and based on volume, that billing service can become a very affordable service. And many other services we all individually pay for would be under the umbrella of the MSO, and powers give you discounts to those services. What will be expected of you as a member of the MSO? In order to participate in the MSO, it's going to be a new way of doing business. So it will require participation in a centralized billing as well as an outcomes tool. It's also going to be necessary to be completely committed to producing a value-based product versus just business as usual and a commodity. In forming the MSO, in order for this new way of business to be done, all contracts will be held under the MSO umbrella, and participation outside of the MSO will not be allowed. How would billing work and what would it cost? So probably one of the biggest questions concerning the MSO is the question of billing. And how billing would work is there would be one company performing all billing functions for every practice in the MSO. This would be done on a percentage of collections. And the national average for collections is 3 to 8%. CPTN has spoken to a couple of vendors, and an average ballpark figure is 7% of collections. For that 7% of collections, that billing company would provide not just the billing functions, but it would also provide full transparency, integration with many EMRs. It would also provide AR meetings once a month and any technical support you would need as a practice owner to get up and running and throughout any of the billing questions that might come up. What are the legal costs? The legal cost to set up the nonprofit MSO would be approximately $10,000 for all of the state filings and incorporation. There would be additional CPA costs for tax returns and more legal fees around producing any kind of legal document or annual minutes. If we got 20 members, the legal cost would be about $1,000 per member. If we were able to get 40 members into the MSO, those legal costs would be about $500 per member. There will be additional costs in the MSO. There's going to be a cost to participate in the outcome tool, and there will also be cost per member for the overhead on the office staff of the MSO. So probably the other really big question for any practice owner is, what happens with my tax ID number? Under the MSO, all of your billing functions would be performed under the MSO tax ID number. You as a practice owner would not give up your individual tax ID number nor your practice name. So anything functioning outside of the MSO would continue to happen under your current tax ID number and your current practice name. So in closing, I just want to emphasize how essential I think the MSO is to the longevity of small practices like all of ours. What we have is power in numbers. And if we can coalesce in those numbers and give ourselves some power, we will survive in this changing healthcare market. And at MSO, there is going to be some give and take, and there's going to be some love and hate. But the MSO is our vessel in order to not only survive the changes of the healthcare market, but to really thrive in the changes of this healthcare market.